Assalamu alaikum. My name is Dr. Dranwerfarooq. Today we will be talk about hemolytic uremic syndrome or HUS. Symptoms of the HUS. When to see a doctor during HUS. Causes of the HUS. An unknown type of the HUS. Risk factor of the HUS. Complication of the HUS. Diagnosis of the HUS. Treatment of the HUS. Hemolytic uremic syndrome or HUS. HUS is a rare but serious disease that affects the kidney and blood clotting functions of infected people. Infections with HUS causes destruction of the red blood cells which can cause kidney failure. HUS occurs as a complication of a diarrheal infection, usually E. coli O157/H7 infection. This disease occurs more commonly in children under 5 years of age than in other age group. Symptoms of the HUS: diarrhea, which is often bloody, abdominal pain, cramping and bloating, vomiting, fever. All forms of the HUS damage the blood vessels. When the red blood cell to break down and form blood clot, this clot damage the kidney drainage. Signs and symptoms of these changes include pale coloring, including loss of pink color in cheeks and inside the lower eyelids, extreme fatigue, shortness of breath, easy bruising or unexplained bruises, unusual bleeding such as bleeding from nose and mouth, decreased urination or blood in urine, swelling, edema of the leg, feet and ankle and less often in the face, hands, feet or entire body, confusion, seizures or stroke, high blood pressure. When to see a doctor: decreased urine output, swelling, unexplained bruises, unusual bleeding, extreme fatigue. Causes of the HUS. The most common cause of the HUS, particularly in children under the age of 5, is infection with certain strains of the E. coli bacteria. Most hundred of types of the E. coli are normal and harmless, but some strains of the E. coli cause diarrhea. Some of the E. coli strains that cause diarrhea also produce a toxin called Shiga toxin. These strains are called Shiga toxin producing E. coli or STEC. When the STEC enter bloodstream and cause damaged blood vessels. Other causes of the HUS can include other infections such as the infection with pneumococcal bacteria, human immunodeficiency virus, HIV or influenza, the use of the certain medication, especially some of the medication used to treat cancer and some of the medication used to suppress immune system of organ transplant recipient. Rarely, HUS may occur as a complication of the pregnancy or health conditions such as autoimmune disease or cancer. An unknown type of the HUS, known as atypical HUS, can be passed down genetically to the children. Risk factor of the HUS: eat contaminated meat, swim in pools or lake contaminated with feces, have a close contact with an infected person such as within a family or at a child care center. The risk of the developing HUS is highest for children 5-year age or younger, adult 65-year age or older, people who have a weak immune system, people with certain genetic changes that make them more susceptible to HUS. Complication of the HUS. HUS can cause life-threatening complications including kidney failure, high blood pressure, stroke or seizures, coma, clotting problem which can lead to the bleeding, heart problem, digestive tract problems such as problems with intestine, gallbladder or pancreas. Diagnosis of the HUS: blood test, RBC, WBC, platelet, creatinine, urine test, abnormal level of the protein, blood, other signs of the infection, stool sample to detect the toxin of the producing E. coli. Treatment of the HUS. Treatment should be in a hospital. Lost fluid and electrolyte must be replaced. Transfusions may need intravenous transfusions of the red blood cell and platelet, surgery and other procedure, kidney dialysis, plasma exchange, kidney transplant. Some life-threatening sign. Get an early appointment with your medical specialist. Have you noticed blood in the diarrhea? Have you or your child had a fever, swelling or decreased urine output? How long have you or your child been experiencing these symptoms? How long has it been since you and your child urinated? This is the pure medical emergency. Rush towards hospital and got prompt treatment to save your life. Thank you very much for like and share this video. Thanks a lot.